Hey, I was wondering if you could excuse me for just a minute while I go on sort of a rant. There's no doubt in my mind that the vast majority of us as transplant patients, we receive the highest level of care available, hands down, far and above any other group. As a matter of fact, I've come to know in my life and expect that when I pick up the telephone to call my coordinators, my nurses, my doctors, I'm going to be talking to someone. I've come to expect in my life that if they decide based upon my phone call or my report of not feeling well, I'm going to be in clinic within an hour or so. And then they're going to be doing the labs, the testing, whatever's necessary to try to get to the bottom of how I'm feeling. There's no doubt in my mind that I've come to expect that once those tests are done, the results are going to be in as soon as possible, perhaps much sooner than most of you would ever think possible. You can have your results and know what's going on and begin getting the proper treatment needed to bring you back up to the greatest part of health that you can have. But I've become kind of deterred lately, upset, downright angry at times in seeing many of my friends via Facebook support groups and such as that, transplant support groups, who are not receiving the level of care I've come to know and basically to even expect. I've seen many of people who are calling their coordinators, calling their doctors, not able to get through, not able to get an answer, or calling and getting a hold of them only to get an answer something like, well, you need to go to your primary care physician, or you need to go to the ER, or you just need to give this some time and see how you feel tomorrow. Friends, for the majority of us, that's not the answer. That's never the answer, especially when there's the potential there as we live on a razor's edge as transplant patients, always the potential hanging over us, for example, to do something like go into rejection, something that could put us in a life or death situation. That is never the answer we want to hear. Now, particularly, it was about a week and a half ago, I think it was, just prior to the Labor Day holiday. On Friday, one of my Facebook friends called their coordinator and reported that they were having fevers and chills and aching all over and typical symptoms that you might suppose was a cold or the flu or some sort of virus. But they called in on a Friday afternoon just prior to Labor Day, and the answer they received right then was basically, hey, take some Tylenol, take something over the counter. We're going to be off for this long weekend. Come in and we'll see you after the holiday on Tuesday. Absolutely not. That's not acceptable. That's not something I would accept. And that's not something she or anyone else should have accepted given that case. So all I'm really trying to say to you today is take a stand for yourself. Stand up. Don't take no for an answer. Expect the highest form of health care you can receive. Now, you can do a lot for that, such as being kind and friendly and building a relationship with your medical staff. I've already done videos about that I'll link to here. But nonetheless, once that relationship is built, once they know you on that first name basis, expect only the best. It's life or death. It can be life changing, and you don't need to take anything lightly. So if you feel that cold, that flu, that sniffle, what you might even think is a sinus infection coming on, what you might take as just nausea or an upset stomach, give them a call and expect that they're going to give you the attention that you deserve, and if need be, that you can have those clinic appointments, those labs, those tests, whatever need be done, and you can get results. So I say it one more time, stand up for yourself and always stay stronger, friends.